Hi, this is Dr. Noel Lloyd. By the way, I have my vintage Lloyd Chiropractic Center t-shirt on. This was from our company picnic 28 years ago. We only had 3 locations at that time. But enough about that. I'm blogging about retention issues in preparation for our 2-day retention intensive that's coming up next month. And so I want to help you with your patient retention. So I want to talk to you today in this short video about the most dangerous place in your office. And I'm not talking about the tear in the carpet where somebody might trip, and I'm not talking about the crack in the sidewalk. I'm talking about the place in your office where smart patients make foolish choices and quit great chiropractic care plans. I'm also going to give you a super tool for finding where those dangerous places are and fixing them. So here's the setup. Let's say you're driving home from church on a Sunday morning and you take the same route every time, but on 1 or 2 different corners, the family rolls out of the back of the pickup truck and down the hill, and you have to stop the truck and back up and go pick them up and put them back in the truck. After a while, 6 or 8 times, you might lash them down in the back of the pickup a lot stronger, or you might take another route. In the same way, if we've got patients in care plans that are falling out in some dangerous curve, and we don't know where that is, shouldn't we, number one, find out where that is? Find out where the dangerous turns in your care plan are, number one. And number two, shouldn't we fix that? Now, the answer to both those questions is yes, we should. And in this video, I'm going to give you a tool for finding out exactly where those dangerous spots are and tell you what to do about it. So first of all, let's draw out a care plan, so we can figure out the route that we want our patients to take, and then we can go back and find out where the dangerous parts are in your practice. So this is how we find most people not feeling that good, and they want as much health as they can get in the shortest period of time. And the first thing we do is we start them in a relief phase of care. I'm going to put an R for relief. Then the next phase of care is correction. So that's correction. And then there's strengthening. And then there's maintenance. And then there's wellness. So that we can put our patient right here, big smile on their face, bright-eyed, bushy-tailed, so relief, correction, strengthening, maintenance, and wellness. Now, you know that a care plan can look like this. People go from relief, and maybe somebody gets the feeling really better, and then they have a little relapse, and then they feel even better than they ever have, and they're in the correction phase, and it goes just about like this. Now, there are different practices that I've assessed over time, and one of the places that people tend to get stuck or quit is they come for one visit, but they don't come back. Those are called the one-and-doners. And then another person gets 4, 5, 6 visits into their care plan, and then they quit for no good reason at all. Someone else comes up to this level here, and they've gotten out of the relief phase, they've left the pain behind, but they haven't taken care of any of the structural problems in correction phase, and they quit. And so there are places all the way down the line where people can end up not getting to the wellness piece. Now, what we want to do is give you a tool so that you can go back and assess your own practice and see where you're strong, see where you may need a little bit of help, and improve your wellness. Our goal, our objective is to find the 1, 2, 3 parts in this route that are the most dangerous, where people are falling out of the truck and not continuing in their chiropractic care. And we'll do that piece next. Now, this is how to find the dangerous stretches in the route between relief and wellness in your practice. So what we're going to do is we're going to take your last 100 new patients. So we're going to run a listing of 100 new patients. And that might, in a busy practice, only go back a couple months. in a practice that's not as busy. Maybe it's all the new patients that you've seen so far this year. And what we want to do is count the quitters. In other words, people who aren't in an active care plan, people that we've lost already. And let's say that half of those people are out of chiropractic care. So we want a list of the quitters, people who've quit. Now, this is the interesting part, and this is the part that when you do it, it could shock you. But this is the place where really the rubber meets the road and you really find out what you need to find out. We're going to go back and we're going to count how many adjustments each one of these people got before they disappeared. Now, what you'll do is you'll start to see a pattern. In other words, maybe the most dangerous part in your clinic is right between visit 1 and 2. There was a young man who came to me and said, 86% of the people I lost, Noel, I lost in the first 4 visits. 86% of the people that he lost in the first 4 visits. What was the dangerous part in his practice? First 4 visits. You might also find that after you do an evaluation, you lose a bunch of patients. Or you might find that patients, as soon as they cross from relief into correction, that the place clears out. So you might find it's between between 0 and 4, and maybe that's your big one. There are solutions for that. And then the next time you lose a bunch of people, it's right here. And then maybe by this time it's number 18. Once you get past 18, you can lose 1, 2, 3, 4, 5, 6. But these are the real dangerous spots. So what are you going to do about it? One of the things that we're going to do is a 2-day retention intensive where we cover everything on taking patients from day 1 all the way up to wellness. And if you come and solve just your top 3 retention problems, that's going to totally transform your practice. Also, it's a great skill to have to be able to go back over your practice, figure out where the weak spot is, be able to apply a particular procedure or a change or a fix, something that isn't hard to do. And that's what we're going to work on in our 2-day retention intensive. By the way, there's a button right down below the video screen here. You can register for that. Here's what you'll get. Over 200 pages of great notes on retention. You're going to get 4 great speakers. We'll have CA breakout. So there's 9 hours of CA work just on retention issues. It's a wonderful, wonderful seminar. And if you register early, you can take advantage of the early bird discount. So you got to get registered, though. So this is Dr. Noel Lloyd for 5-Star Management. I've hoped that this helps. I'll talk to you later. Bye-bye.